Hi everyone, I am Dr. Liu Shanfao, gastroenterologist from Timberland Medical Center. In conjunction with World Hepatitis Day, 28 July, I would like to share with you the topic on hepatitis B. In view of COVID-19 pandemic, we have to do it in the video recording manner in order to adhere to the SOP and also social distancing. I chose the topic of hepatitis B because this is a very common condition in our populations. And we do see nowadays many patients presented with late complication of hepatitis B, including liver cirrhosis, liver cancer, and liver failure due to untreated hepatitis B. I would like to take this opportunity to create some awareness in our publics on hepatitis B. I wish to make this presentation a simple one and also a relaxing one. I hope you find this short presentation useful. So let's get started. Hepatitis B infection. In Malaysia, estimated 1 million people are living with chronic hepatitis B infection. 1.5% to 8.9% of general populations are hepatitis B positive. Younger populations, those less than 32 years old or those born after 1989, have much lower prevalence of chronic hepatitis B. As a result of universal hepatitis B vaccination at birth in Malaysia, introduced in 1989, it is estimated only about 0.09% of population at this age group is hepatitis B positive. The hepatitis B is caused by hepatitis B virus. It is a very small virus, 42 nanometers, with partially double-stranded DNA encapsulated in a core protein and also lipid envelopes with the surface of protein part of the surface called surface antigen. This virus can enter in our bloodstream and go into the liver cells, causing infection or inflammation of the liver called hepatitis. The inflammation causing swelling and also reddening of the liver cells and liver tissue, subsequently causing liver damage by causing fibrosis, it is scarring, and also liver cirrhosis, i.e. the hardening of the liver. How is hepatitis B transmitted? Majority of our populations get hepatitis B during childbirth, and infants can get the infection during childbirth if the mother is hepatitis B positive. We have to take note that breastfeeding does not appear to increase the risk of transmission. The other way of transmission of hepatitis B by contact with blood, semen, vaginal fluids, or other body fluids through sexual contact activity, sharing needles, sharing of hygiene equipment like razors, toothbrush, etc., and also unsterile tattoo and also unsterile surgical procedure. Hepatitis B can divide into acute hepatitis B and chronic hepatitis B. When someone gets infections, after more than 6 months, if the infection persists, we call it chronic hepatitis B. In acute hepatitis B, most people may not have symptoms, but some may have poor appetite, nausea, fatigue, low-grade fevers, and also muscle ache and joint pain. Some individuals may develop jaundice. It is yellow skin and sclera and dark urine. Some individuals may develop vomiting and need hospital treatments. Chronic hepatitis B also, majority of the individual may not have symptoms. But of course, in the late chronic hepatitis B or advanced liver disease, you may see jaundice and also dark color urine and abdominal distension with fluids called ascites, and also confusion in mental state called encephalopathy. This chart shows the progression of hepatitis B infection. In short-term infection, some may develop into long-term infection and some may resolve with recover from hepatitis B. In a long-term hepatitis B, you may develop into liver cirrhosis and also subsequently liver cancer. And we have to take note that in infants getting an infection from mother, majority of the infants may develop into long-term hepatitis B, up to 90 to 95% of individual, and only like 5% may resolve and recover from hepatitis B. However, in adult population, after getting the infection, majority up to 90 to 95% of the individual may recover from hepatitis B, and only 5% may develop into long-term hepatitis B. This chart shows the rate of developing liver cirrhosis and also liver cancer. As you can see from the red line, and someone with hepatitis B over the 10 years, up to 7.5 of the people or patients may develop liver cancer. And when you follow the blue line, up to 16% of the individual may develop liver cirrhosis. However, if we look at the individual with liver cirrhosis in a dotted red line, up to 30% of person may develop liver cancer over 10 years period. So what we can see is if someone with hepatitis B and liver cirrhosis, the risk of liver cancer is much higher. What other tests can be done for hepatitis B? We normally do surface antigen HBsAg for screening and diagnosis, and of course the S antibody to testing of hepatitis B antibody. The envelope antigen and envelope antibody, HBe antigen and HBe antibody, can be utilized to determine chronicity of the disease and also to guide the treatments of hepatitis B. Anti-HBc, which is a core protein, the antibody can be utilized to indicate history of infection. B. The more important blood testing for hepatitis B is HBV DNA viral load, which indicate the level of virus in the blood. This is very important test to show the activity of the virus in the liver and in the bloodstream, and indicate whether someone needs the infection and also the severity of the hepatitis B. Of course, some other tests that can be done include liver function tests, which we can see the component of AST, ALT, ALP, and GGT, as well as albumin and bilirubin, to look at the inflammation and also the function of the liver. Last but not least, alpha-fetoprotein, AFP, is the liver cancer marker, which can be done to indicate any possibility of liver cancer in hepatitis B. Ultrasound of liver is the important test for a person with hepatitis B. As you can see from the pictures, ultrasound probe is applied over the right upper abdomen of the patients to scan the liver to look the structures of the liver, where we can detect any evidence of liver cirrhosis, structural changes, as well as any mass or nodule in the liver to indicate liver tumor or liver cancer. Of course, ultrasound liver only utilized to screen for liver cancer, but not to confirm liver cancer. We normally do CT scan with contrast or MRI with contrast to diagnose liver cancer. We rarely need to use the needle to biopsy the liver nodule to diagnose liver cancer nowadays. One important test for hepatitis B is FibroScan. This is a simple test, non-invasive and painless test utilized to test for the liver condition. As you can see, a FibroScan probe is applied over the right outside of the abdomen over the liver to detect the steatosis grade and also fibrosis score of the liver. The steatosis grade is the severity of fatty liver or hepatitis, and fibrosis score is the severity of fibrosis, which can predict the evidence of liver cirrhosis. The important thing of FibroScan is it is a prediction of severity of liver cirrhosis or fibrosis, which will guide us to treat the hepatitis B. In the old day, we normally use liver biopsy to look at inflammation and also fibrosis of the liver to guide on hepatitis B treatment. Nowadays, this is replaced by FibroScan. So it is an important test. The most important way to prevent hepatitis B is through vaccination. The vaccination is most effective given during childbirth and at 0, 1, and 6 months, 3 doses regime, which can prevent and also giving immunity to the infants. Of course, an adult without antibody also can go for hepatitis B vaccine, a 3 doses regime 0, 1, 6, given an intramuscular injection. And of course, over years, after a few years, the hepatitis B antibody may disappear, and we may have to have booster of hepatitis B vaccinations. We talk about treatments of hepatitis B. The mainstay of treatment is oral antivirals. It is effective and very safe for long-term treatments. The previous agents include entecavir and also tenofovir. Of course, other regimes like lamivudine, anthracycline, adifovir, tavibudine are been used before. I would like to suggest you discuss with your doctor on the choices of treatments. The treatment duration normally is several years or sometimes in a chronic individual is indefinite treatments. The other treatments that we need to know is interferon, which is given a subcutaneous injection. Normally it's given 1 year treatment with a weekly injection. The treatment is suitable for younger people, female, low DNA viral load, and also rest liver function tests, including ALT. However, the injection of interferon treatments have more side effects, and most people do not like it. And it is more effective in hepatitis B genotype A. As we know, in Asian population, we have a high percentage of genotype B. Therefore, it is less effective in Asian population. What are the benefits of treatment? The treatments of hepatitis B reduce the risk of severe hepatitis, called hepatitis B flare, and also liver failure. It also reduces the progression of liver cirrhosis and also reduce the risk of developing liver cancer. It is important to follow up with your doctor in someone with hepatitis B to screen for liver cancer. We call it liver cancer surveillance. Early detection of liver cancer means cure, and late detection of liver cancer normally is inoperable and not curable. The follow-up should be done every 6 months with blood tests by doing the cancer marker, alpha-fetoprotein, and also ultrasound of the liver. So in summary, hepatitis B is a serious liver condition, and untreated hepatitis B causes liver cirrhosis and liver cancer. And vaccination can prevent hepatitis B infection. Blood tests, ultrasound of liver, and fibroscan are important tests of hepatitis B, and effective treatment is available for hepatitis B. 6 monthly doctor visit and liver cancer screening or surveillance with blood test of alpha-fetoprotein AFP and also ultrasound of the liver, it is important. With that, I thank you.